Okay, so today we're going to do the CBO for the AGM check. So the first thing you want to do when you come in is turn the top screen on. It's just a little switch there. And to turn the bottom screen on, you just want to turn this to on. When you turn that one on, it's going to do a self-test. It just takes a couple of seconds and it does it automatically. The next thing you want to do is check your anesthetic gases. So you want to take them out. To take them out, you just turn this little lock here to take it out, and there's a little trigger in the back. You just pull the trigger and it pops out. So you want to set it on a flat surface to check the level, and to check the level you want to just check to make sure that the gas is lined up with the top line here. You can see that on both of them. These are full, but I'll just show you how you would fill them if you had to. So you take the cap off that and get the gas out of the bottom drawer here. And you can see that there's kind of a little key on the bottle, and you just want to line that up with the key on the cartridge. So you just push it in and you'll hear bubbles coming up through the bottle, and you want to just watch the level and make sure it's not overfilling or anything like that. And then when the bubbles are done coming up, you just take it out, put the cap back on, put the cap back on the cartridge, and then you're good to go. So to put it back in, you kind of have to push it hard to get it back in, and then you always want to make sure that you lock it back in when it's done. And the other cartridge goes under here, and it goes in the same way. You don't have to push it hard when you put it in here, and just make sure you lock it. And another thing is you want to just make sure you have the checklist. It's almost always on the side of the machine here. It's just something you go through every day.
Okay, so we're going to show you how to do the actual check first. We're going to bring that over. The very first check that you have to do is the low pressure leak test. So to do that, you need to grab the little bulb, which is always in the bottom drawer down here. So that's this little piece right here. So you're going to scroll down. These are all the different checks you have to do: system, circuit O2 cell, low pressure leak, and agent delivery. And we're going to go through all of them. So low pressure leak. You click on that. Each one of them has a list that tells you what to do. Make sure ACGO is selected. So the ACGO switch is right here. It's either set at, most of the time it's set at circle, but for this you have to switch it down. Switch it down and plug in the bulb. Okay, and then basically you have to squeeze it a bunch of times until it sucks all the air out of the circuit. You want to leave it so that basically you're going to leave it for 30 seconds, and you don't want this to reinflate. You want it to stay like this. There's a timer on the side here, so if you hit that, you'll see the little timer come up. So I'm going to leave it for 30 seconds. Usually when you do this, you come around to the back of the machine and you always make sure you check that there's a bag for emergency situations. If you don't check, they'll fail you on your CBO. You want to open the oxygen cylinder to see what the pressures are, which will show you. It comes up on the gas machine after. Usually turn it about 3 times. So open it 3 times, and I'm just going to close it again. 2, 3. I usually check the CO2 canisters, so they always have the extra one up here. And the one in use is always right here, and there's the collects water down here, so if there is water you can empty it, but there's nothing right now. The only other thing you have to check is on the wall back here, the medical gas alarms. You want all of these to be within the normal range. So basically you want them green. So to test it, there's a little test button on the side. Hit that, and yeah, they're all green. So we're good to go. So the 30 seconds is probably up. So yeah, it's been a minute. And the bulb's still pretty deflated. So yeah, so all you have to do is hit pass. And that's the low pressure leak test. You flick that off on the gas machine checklist. So back. So you don't need the bulb anymore. After you've done that, you're going to switch it back to the circle system. Okay? So the first check you have to do is the system check. So once again, it tells you what to do. Set the bag/vent switch to vent. So that's right back here. You can see a little picture the ventilator, and the bag. It's set on bag right now, so you're going to switch it over. You want the patient Y opened, so you want this open to atmosphere, and then start. So basically you just have to hit start. This one only takes about 20 seconds. So we're just going to let it go. Yeah, you can see that the CBO is in, so it'll automatically detect it right there and tell you how full it is. If you were to place the desflurane in, it would be blue and it would say des up top. So this should be done. The second part of this, basically all you have to do is occlude the patient Y. So you disconnect the mask from the circuit, and on the side here, there's a little piece right here that you can plug this into to occlude it. There. So, and all you have to do is hit continue. This is the longest one, so it's about 4.5 minutes. So during that, we're going to show you the different parts of it. Show the parts, and then you do that. Okay. So there's the bag and vent switch, which I already showed you. The APL valve is right here. It's for the most part it's set to min unless you're going to bag someone. There's the ACGO switch set to circle, O2 flush valve, which we're going to show you later. So on the front there's an extra flow meter in case you need the bag, the volatile gas that's set up. Your suction supplies are right here, and your alternate O2 control is right there. You pretty much never use that unless the blender fails. Yeah. Anyways, so you go up a little bit. This is where all your blood pressure, sat monitor, heart rate, end tidal CO2, all that stuff plugs in right here. So we already showed you the cylinder on the back. There's the scavenging systems. Scavenging system is the little pink line which goes from here to connects to the bottom down here. You want to make sure that's connected for the check. And yeah, there's the patient bag and the bellows.
Okay, so another thing is the stuff over here. When the patients come in, you're going to be usually expected to hook up the ECG onto them. So you just take these, and there will be little connectors over here on the side to put on. So you just open that up, and there's three in there.
Sticky pads.
Yeah, just sticky pads. And a good way to remember where to put them on the patient is the white goes on the right of the patient, and then smoke over fire. So this one will go low, this one will go high. Another thing is the SAT probe. You'll usually be expected to put that on, just put it on a finger. And the blood pressure cuff, usually a nurse will do that or something, but you might have to too. You just put it on the arm, and it has a little arrow here for where the brachial artery should be. And you just put it on snug, but not too tight. Another thing is your suction is here. You saw the control on the side there. You always want to check that and make sure that you have good suction. And then this is the temperature probe. It has little adapters here to put on it, and some anesthetists use it, some don't. So if you need to use it, that's where that is. And your suction canister is down here. You want to make sure that everything's connected nice and tight so it doesn't come off when they're trying to use it. And another thing is, if it's not working, you want to make sure that this here is not to the off position, because then you won't get any suction. You always want to make sure it's on the on position. Another thing is all your supplies are up here. So you have your HMEs up here, your LTAs, stylettes, temperature probes, suction catheters, your BIS monitor, the light wand, which we rarely use, the yonkers, and suction tubing. And you always want to make sure you have a good supply of towels up top in case you need them. And you always make sure there's a box of Kleenex just for little wipe-ups. And there's extra blood pressure cuffs over here for the pediatric or infants. You always want to make sure they're there. That's on your checkout. Okay. So the test is almost done here.
Yeah. So the system check is just finishing up, and then we're going to move on to the circuit test. here. Okay, so that's done. Everything passed. Yeah. Okay, so now you want to go down to your circuit test. One thing you always do, you can do it pretty much anytime. I usually do it at the very beginning. There's the one more test, the calibrate flow transducers. There's a little piece on the side right here. Basically, this part right here. There's a little switch on the bottom that you can pop out, and you just gently wiggle it out. So you just leave it outside its position for a second. You should see an alarm come up here. So no inspiratory flow sensor, no expiratory flow sensor. So that's all you have to do to, you basically plug it back in and it should go away, hopefully. There. Okay, so some people do it at the very beginning, some do it in the middle, just as long as it's done. Circuit test, so you go down to circuit, hit enter. Okay, so you want to occlude the patient Y, which is still occluded down there. So you want it switched to bag, and set the ACGO switch to circle, which it's still set at circle, so point it up. Yeah. And then you want your APL valve between 30 and 70. You should hear the little click when it goes above 30. Yeah. So, and that's all you need for this one. So, 34 seconds. Yeah, I guess we'll just wait for this one to finish. Okay, so we're going to look at the sheet for a second. Basically, it's going to go over the high pressure systems. So that's the high pressure system is basically the oxygen tank. So we checked it in the back. All the information will come up right here. So the tank, the PSI is 1353, 1348 in between there. So you want it above 1,000. If it goes below 1,000, you have to switch. And that just gives you the pressures for the lines coming from the wall. So oxygen 55, nitrous 55, air 49. And you have to record them all on here. Okay, so circuit test is done, everything passed. Now you have to do your circuit O2 cell. So you hit that. You want to open the patient Y. So just leave it open to atmosphere, and you want it to switch to vent. Basically, you're looking for the FiO2 to drop to about 21-22%. So it's going down. We have to give it a second. While that's going on, we can look at the checklist. The second part's the low pressure system. So check the CO2 absorbent, which we did, fill the vaporizers, and the low pressure check, which was the one we did right here with the bulb. So that's done. The scavenging system, you just have to make sure it's connected. That's that pink line in the back, which we already checked. Automatic ventilation system, so that's the last part you do. Basically turn the vent on. There's the monitor vacuum. That's all your equipment, which Cody's going to go over in just a second. So, circuit O2 is at 21%. So you actually have to record 21% on this. Okay, so we're going to hit done. Suppose I can get you to do this. The next one is the low pressure, agent delivery. So for this one, you're going to take the CBO out and put the desflurane in. Make sure they're both locked in. Okay, so you're going to occlude the patient circuit because it's going to actually be desflurane going through, will come out the end if it's not occluded, and you don't want to breathe it in. So put it to vent, it's already on vent right here, ACGO to circle and occlude. So start. That's going to take 2.5 minutes, and while we do that, we're going to do the extra equipment we have to check.
Okay, so that's in the drawers here. So in the top drawer, you want to make sure you got some lube. You want to make sure you have some extra blades and handles, and you want to make sure that it's working. So you can see the light there. Yeah, just make sure they're all working. And always make sure that you leave a blade on the handle when you're done. You want to make sure that you have extra 10cc syringes to inflate and deflate the cuff. You want to make sure you have extra wands and stuff for the lidocaine spray, and make sure that there's some in there, and make sure that it's not expired. You want to make sure you have extra, or that you have McGill forceps in case you need them. Extra swivels for the end of the tube. And you want to make sure that you have MDI adapters to give MDIs. In the second drawer, you want to make sure that you have a good variety of masks ready in case you need them. Make sure they're all in nice order, and make sure that you have lots of OPAs in case you need to use them when you're bag masking or anything like that. And in the third drawer, you want to make sure that you have lots of anesthetic gas, and if there's any missing, you just go get some and refill it. And make sure that you have all the tubes that you need, and you'll also have your bulb in the bottom here for your low pressure test.
Okay, so the agent delivery is done. So you hit back. Before you actually start the ventilator, you want to go to the check log and make sure that everything's passed. So passed 16th, 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 16th. Everything passed today. So yeah. So to start the case, you go all the way down to the bottom. Start case. You always want it set on bag before you switch it over, because you're always going to bag a patient prior to intubation. And so I'll show you. I'm going to set it to vent and just show you what happens. So I'm going to try to start the case. Oh. Okay, start case now. So it's going to give you an error. Move or switch to bag. Yeah, so you switch that over and it'll automatically start. So you can bag the patient. Yeah, and I made a mistake. So you have to take the patient, well, unocclude it and hook it up to a test lump. So, yeah, that's fine. So we're going to switch it over to vent. So the mode it always starts out in is pressure control ventilation with volume guaranteed. So it's kind of like PRVC. You have a set tidal volume, and it's only giving about 300 mils right now, 216. So it's going to increase the pressure until it hits that. You want it to be within 7% of the 600, whatever you have set. So you have to test 4 alarms in the vent mode. The biggest one is in the back, the oxygen failure alarm, which is right up here. You have to disconnect that. Okay, so we're going to go around to the front. It's going to give you an audible and visual alarm. It won't let you do anything until you either hook up the cylinder or fix the problem. So I'm just going to hook it back up. Okay, so that should go away. So yeah, you always have to make sure that's working. So it's almost there. It's at 500 now. Down here is the O2 flush button. It gives, when you hit that button, it'll give about 35 to 70, 75 liters per minute straight to the patient. Just gonna wait for this to go. So it's at 544 right now. It's a couple more breaths and it should get there. You have to record the actual tidal volume, the closest you can get. So yeah, I'm going to show you the 3. So it's a 588. It's within 7%. So basically you have to do a high pressure, a low pressure, and an apnea test. So the high pressure, you're going to take the bag, and when they take a breath in, you're going to squeeze it. So create a really high pressure. So high pressure. And to get the low pressure, basically you just disconnect the bag, and after a few breaths, the bellows will completely empty. You should be able to see it up here in a second. So unable to drive bellows. So that's the low pressure test. There's a big leak. We're going to switch it over to bag to test the apnea alarm. So this takes about 30 seconds, but hopefully it will come up. Let's see. should be coming up in a second. Okay, apnea. I'm just going to show you when you hit the O2 flush button, you can see the bag starting to fill up, so it's going straight to the patient. That's all you have to do for this part. So you hit the little start end case on the side, and end case now. Okay, so before you finish everything, you want to get rid of any alarms, like past alarms that are up here. So you just hit the silence alarm buttons, just because it confuses some of the people that come in every once in a while. So basically the last part of the check is the final position. So you want to hook the bag back up to circuit. You want to hook your breathing circuit, so you have your mask, HME, and you have your end tidal hooked up. Sometimes they get you to test the end tidal. You basically just take a mask and you put it inside of it and you breathe into it a few times and you'll be able to see the CO2 pop up. They also want you to test the pulse ox, so you just put it on yourself. That part's really easy. So the circuit's all ready. You want to make sure that it's set to circle, so it's pointed up, which it is. You want the APL valve to be set to minimum, which it is, and you want it to be set to bag. And you want to, the only other thing we didn't do is test the suction. So the suction stuff is right here. And you can put it on max, you can hear it, but it's always a good idea to put on some gloves and yeah. So the suction's adequate. You can put it on there and adjust whatever suction you want, but most of the time it's just going to be Yonker. And that's pretty much it. If the case doesn't start in an hour, you can turn off the monitors. If not, you can just leave it in standby, just like this. That's pretty much it for the gas machine check.